Uncensored and Unfiltered. I'm here with our beautiful brand ambassadors, Jessie and
Hey
Dunya,
guys. Hi everybody.
and with our guest of honor, Dr. Dress.
Good afternoon. How are you?
So we want to take this unique opportunity to speak with you in regards to plastic surgery, get to know you a little bit more on a personal level. We're going to get physical. Things are going to steam up here very quickly. I hope you're ready.
I'll try.
Okay, very good. So, first thing I want to ask you about, we're here on Wednesday, hump day. I know that you've been in the OR this morning. What cases have you done?
Well, started with a Brazilian butt lift operation, the BBL, and then transitioned into a large tummy tuck, and most recently just completed a mommy makeover.
Okay, very good.
Doctor, if you have to choose one procedure as your favorite one, what would it be?
I would say a breast lift.
Breast lifts, and why is that?
There's so many different variables that you can implement and alter and modify, and everyone is different.
Yep.
Everyone is different, so it really requires, coming up with the right recipe for the patient's, targeted desire.
And it really is one of those procedures that you get this instant gratification.
Instant gratification.
Because you look at the results and it's just immediate, the change that they go through. Now, speaking about breast lifts, because I'm happy that we discussed that. That's something that I really want to get done because I just had a baby a year ago and I would love to get a breast lift. But I've been told that I might need a mesh. What exactly is a mesh, and how do you know who's a good candidate for that?
That's a great question. So a mesh is a term that we really should call a matrix. Mm-hmm. It's a biologic tissue that we use to suspend the breast tissue in patients that may have implants, and those implants may have actually descended more than they're supposed to, or they just have dense tissue of their own, and that tissue needs more support than the patient's own skin flaps can provide.
Okay, fantastic. So just a little backstory, I'm having like a little consult in live here in front of everybody. Nothing is off the table. I'm an open book. So I've had a breast reduction.
Okay.
I lost a lot of weight. I had my breast reduction when I was 16.
Got it.
So almost 20 years ago. And then I lost tons of weight in 2018, and I was left with just a lot of skin. So we put breast implants in, but then I had Julian, my 1-year-old, and I've gained some more breast tissue, but they're just not where they're supposed to be. I love the size of my implants. I have 415cc silicone implants, which for me are great. They were sized, they were beautifully done, but gravity, things change after having a kid.
Sure.
I really need it. So do you have to give me new implants, or can we use the same ones?
More often than not, as long as you're not having problems with your existing implants, they can be reused without difficulty. And if we were using, let's say, a lift or with or without the biologic mesh that actually comes from different types of animals, the most common that we use is from the pig, believe it or not. And so all of the foreign markers in that pig's dermis tissues have been removed. And it's just literally wide for our own cells to move into, and our body recognizes that whole topography and parks the blood vessels where they belong, the nerves where they belong, and turns that tissue into living tissue all over again.
That's
so
amazing.
If we were going to use that, we wouldn't even need to necessarily be inside the capsule where the implant is.
Okay.
And so I actually spend more time and effort to try to stay outside of the capsule, so that we're not potentially introducing anything around the implant.
So doctor, what's the difference between saline and silicone? Which one is better? What's the difference?
Sure. Well, they have different purposes. I tell patients that, if you've got like a C-cut breast and you're wanting to go larger, then silicone isn't necessarily going to be much more help for you. You already have enough tissue. You just need to basically reposition and give it a foundation, and saline is an excellent alternative for that because it's relatively firm and it holds its shape better than the silicones. The silicones are much softer and much more compliant, and they shape themselves to the patient's overlying skin best.
So now you know.
It's more natural, a little more natural looking, but the saline is a little bit more of a more fuller, rounder appearance.
Right. In fact, if a lady shows me a picture of, perhaps, a stripper, those are almost always salines because they give that firm, round look with fullness all the way around. And it's not the typical, more natural teardrop shape.
And they have the same durability, right?
Well, the data actually shows that the silicones have a much lower rupture rate.
Oh, wow.
Okay.
Yeah.
So the problem is that when a saline ruptures, we know it immediately because the breast usually goes down to where it was before or even smaller than, because all implants cause some of the breast tissue to shrink away, just the pressure of the implant.
Got it.
So that's why we often have to put a little more in, or we want to go a little larger than maybe the patient had in mind at the get-go to compensate for that down the road. But the saline is quoted at rupturing 1% per year.
1%.
Okay.
Okay.
1% per year. So in a decade, 1 out of 10 ladies has had a saline rupture. The silicone is typically around 1.5% to 2% over 10 years.
Oh, wow.
So it's much, much lower in that regard.
Great.
And the problem therein being is we can't tell when a silicone implant has ruptured on clinical exam.
Okay.
We have to do, it's usually kind of sort of noted on a mammogram that's being done for routine screening purposes, but then a breast MRI is what's required to definitively identify a tear in the implant.
Okay.
And doctor, have you done more saline implants or more silicone implants?
I would say in my career it's about even, but since the silicones came back on the market in the late 2006 timeframe, it's been definitely skewed in favor of the silicone gel.
Yeah.
Yes.
I just got silicone implants
Okay.
a year ago,
Okay.
and I feel like that's what a lot of people were getting, the silicone one instead of the saline ones.
I would agree. I think that, if somebody comes in with saline implants and is complaining about ripples or wrinkles, even though we went under the muscle, they're very commonly seen on the lower outer portion of the breast. And that's because it's just basically breast skin and a little bit of tissue there. The answer is to switch them out to silicone.
And gummy bear is the same as
Yes.
silicone, right?
Yes.
Because they come asking for gummy bear, so it's the same, right?
Yeah, so the 4th and 5th generation silicone gel implants are what is called commonly gummy bear implants, and it just means that they maintain their shape even if you remove the shell.
So it's cohesive gel.
Extremely cohesive,
Okay.
yes, so much so that it holds its own shape even without a shell.
And that's why it's called a gummy bear, because if it's a gummy, if you cut a gummy bear and
Yeah.
you try to squeeze it out, it all stays in
Yeah,
there.
Yes.
there's nothing inside it that's in a liquid state.
Very interesting.
I've seen a video of them running over an implant,
Yeah.
and the implant doesn't rupture, it stays in its place.
I've got one that I've slammed in my exam doors hundreds, if not thousands of times,
Yeah,
and it's
That's
still,
right. So
it's still doing
I've
great.
walked down the hallway and it's just like a normal Tuesday morning. I'm sipping my coffee and all of a sudden I see a silicone implant being slammed against the door, and I'm like, oh, that's Dr. Dress.
Patients are always shocked that the thing doesn't tear or rip in half.
That's
always, and I want-
amazing.
just demonstrating the durability of these things.
Next time we do a live, we have to bring it, and I'm going to try to we're gonna try to sit on it. We're gonna be putting our heels on it. We're gonna fight on it.
Perfect.
When
Tug
I
of war.
had my consultation, when I went to my doctor, I had to feel the silicone in my hand,
Right,
put it in
right.
my bra, do everything so I could be really prepared for the surgery.
Perfect.
Yeah,
That's
they're
the
very-
perfect way
yeah.
to do it.
Yeah, they're they last a long time, and you don't have to exchange them anymore like it used to be.
Yeah, there's no, when that was being basically told to patients, especially in the 70s and 80s, it was because silicone implants did degrade inside the patient.
Okay.
And they had very, very little, if any, bleed barrier, so the free silicone could get out, even without a tear in the actual shell.
But that hasn't been needed since what year?
So those were revoked by the FDA in 1992.
So ever since then, you don't really need to replace your implants.
Correct.
And there's so much misinformation that everyone still thinks that you have to replace your implants every 10 years, but you don't really have to.
You do not. When a patient comes to me and says, hey, it's been 10
Like
years,
30
I was
years
told
ago.
that I had to have my implants exchanged, I always say, are you having any problems with them?
They feel good, they look good, then don't change them.
If it ain't broke, don't fix
Exactly,
it.
don't fix it.
That's right.
And speaking about breasts, there's a patient who's on our chat, and her name is Gertrude. Hi, Gertrude. And she wants to know whether Dr. Dress would operate on a patient with granulomatous mastitis.
So the granulomatous mastitis is not a contraindication to having an operation on the breast. If we were going to be using implants, I would say we would be going underneath the pec muscle to stay out of that. But we also want to make sure that you and your treating physician are aware of what we're about to do, and we definitely would like his or her guidance and clearance
Of course.
from that perspective.
So I know safety is a huge concern for you. It's our number one priority here at Avana. What do you request for patients prior to having surgery with you? What do they need to get done?
Okay, so if we're doing breast surgery, then a baseline mammogram or ultrasound is requested. And that just gives us a baseline, because your breast is not going to look the same on the inside at all when we're done. And so 6 months after this operation, we actually do a new one, so that your radiologist and your physician have a baseline with which to compare any potential future lumps or bumps that may show up, and to give them better idea that the calcifications might actually not have anything to do with cancer and might be post-operative calcifications that might be seen.
So if the patient had the breast augmentation, how long does he or she has to wait to exercise?
So generally, we don't want the pec muscles being utilized too much after surgery until the capsule has formed at least 90% of its tissue and tissue strength, because it's the capsule around the implant that holds the implants in position. So 6 weeks is where a healthy patient, a non-smoker, non-diabetic patient, gets 90% of her tissue strength in that capsule.
So I'm glad that you actually spoke about exercising, because you actually have some questions about that. Because you were mentioning, because you do work out a lot.
Yeah.
But ever since you had your breasts, and you don't like to work out your chest, or how do you feel?
Well, because my surgery was so recent, I've only had it for a year, but I used to work out my chest a lot, and I wanted to jump back into working out my chest. So after the 6 weeks, I did start working out, but I just didn't feel comfortable working out my chest yet. But now that it's been a full year, like, I feel really comfortable working out. I did it the other day. I worked out my chest, and it was fine. But
And everybody is different.
everybody's different, yeah.
Absolutely.
And it's just like how I felt comfortable in my body, and not really like.
But now you're doing it, and you feel
It wasn't
perfect.
painful or nothing, but it was more like
Just weird.
I wanted for it to settle really good before I did any exercise. Yeah.
Because you were preparing a lot for the surgery, so there's a lot of things that you were involved in to make sure that your surgery went well, and you didn't want to do anything
Exactly.
to maybe affect your results. But you hear it here from the doctor. You're okay. You're cleared to go back to resuming your activities in 6 weeks.
6
Yeah,
weeks.
but definitely listen to your doctors when they tell you that you can't do certain things.
So important.
Because I know
Right.
people that will jump right back into everything, and that's not what you want to do.
Speaking of jumping into everything, sex.
Yeah, that's what I was talking about.
There you have it.
There you have it. Everyone wants to jump right back into it. And I'm sure it's a question that you get often.
Yeah.
How soon after surgery can you have sex?
So it depends on what surgery you had.
And what kind of sex you're having?
That too. That too. So if it's breast operation, then it's at whenever the patient feels up to it. But if it's something that utilizes core muscles, for instance, after a tummy tuck, we would not necessarily want you having sex for 4 to 6 weeks.
Whoa, wait a second. Wait a second, because these mommies
That's
are
right.
getting their brand new body back.
That's
Now they
right.
got to wait 4 to 6 weeks to enjoy
4
it.
to 6 weeks is the safe answer.
I think there's a trick.
There's a lot of core muscle work that we do there.
Not necessarily. Have you ever heard of the dead cow position?
No, I haven't.
You haven't heard of the dead cow position? Well, let me explain to you what the dead cow position is, because I did it a lot in my pregnancy. Okay, so what you do is you lay down, right? You're like laying down in bed. You put your legs like up, and you just kind of lay to the side.
So what if you had a BBL?
And then he penetrates you from the back, and you're just the dead cow. You're not doing
Well, there
anything.
you go.
So you're
Yeah,
talking about like a side.
If you're not using your muscles,
It's the side, but
you're
not
okay.
like a normal.
If you're not using your muscles, you're okay.
You're not like a real side. You know, like sometimes you're in the side
Right.
position. You got to do something. So you're like, yeah. No. This is the dead cow. You're a cow that is dead on the grass, and you're just.
There you go.
Gigi,
You
there's
know?
another word for it.
What is it called?
Pillow princess.
Pillow princess.
Yeah.
But is that really? Is that the position for
I'm
the
a
pillow
pillow
princess?
princess for
You're
sure.
a pillow princess.
Yeah, that means that I like
That
to
is
lay
so
down.
disappointing, Jessie.
And the
I like
dog,
to
and
lay
the doggy
down.
style. Doggy
There you
style.
go.
For BBL, doggy.
BBL
Yeah.
doggy.
Yes.
No, but you can't do BBL. You can't do a doggy right after BBL.
It's not recommended.
It's not recommended.
recommended.
How long do you have to wait?
Everybody's different, but there's fresh incisions there.
Yes.
And there's fat
Yeah.
that we're hoping doesn't get disturbed as much as possible.
Yeah, you don't want that fat to end up like in upper back.
Well, it won't migrate, but it is very, very tenuous. And the fat only survives long term if our blood vessels grow into it.
Okay.
And so if you're having any type of shearing forces, you're going to be shearing any of those new little capillaries. And again, that's another 6-8 weeks before you have total invascular.
After your BBL, you have to wait 6 weeks.
That's the safe answer.
Okay, but then you can go to town
Yes.
and enjoy it. And so
Yes.
that's what she was saying.
I waited 20 days and I
Okay.
did my doggy style.
Perfect.
And it was fine.
What's amazing, I didn't lose fat. I still have my booty.
Don't
Perfect.
listen to Dunya, listen to Dr. Dress. And if
Don't
you're
listen
having
to
a
me.
tummy tuck, consider the dead cow or the.
Pillow princess.
Pillow
And I've also
princess.
heard of a starfish.
Starfish.
You're a starfish?
I'm not. I
You
have
know
not.
what starfish
What do you
do?
recommend?
Just like lay there.
There you go.
Yeah,
love
just lay
it.
there. There are ways to go about it, ladies. If you're like us and you have to have sex and you can't wait 6 weeks because 6 weeks is a lot,
That's right
there are
to wait.
other things you can do that are creative and that will not hurt your results. But
Now, with the caveat that
But-
if the patient has had some type of vaginal procedure by us,
yes,
we certainly do not want anything there.
none.
You know,
Not
nothing,
at all.
nothing. Or even lip implants or lip injections.
Which lip injections? The top or the bottom?
Either.
Because we do lip
Either.
injections here as well.
Yeah, we definitely don't want any oral sex after having had lip implants or lip injections, a fat transfer to the lips, because it can certainly cause migration.
Receiving or giving?
Receiving
And
/
given.
giving.
And given.
I guess they're the
I'm
same.
so confused.
Can you kiss?
Well, depends how aggressively you kiss. A peck on the lips is
How
going to be
aggressive
okay.
you
How
kiss?
aggressively do you
How
kiss,
aggressive
little
you
princess?
kiss? Are you more like, or
I'm pretty aggressive
That's
when
right.
I kiss.
You're pretty aggressive when
I
you
like
kiss.
to go in there.
Gotcha.
Pretty
There you
thorough.
go.
bad girl?
She
I
sets
love
him up for disappointment because she kisses him with passion and then she's a pillow princess.
I know.
So,
You're taking it behind.
But I had a patient who I had done injections and lip implants on, and she ended up not listening to the recommendations, and the implant had migrated all to one side of the lip.
well, listen, honestly, now now speaking seriously, you've spent all this time and
and-
energy and pain
and
and
pain
money
and money.
to perfect your body or perfect your lips or do what you want to do. Take the time that is needed. Listen to your doctor. And there's other ways, that,
There are.
okay,
Be
you know
creative.
what? 6 weeks, you can't have sex with another person, but you can have sex with yourself,
That too.
right?
Battery operated boyfriend.
Your battery operated boyfriend, that's exactly it.
Yeah.
Or boyfriends. I'm sorry, do you have something in your throat? Does that hurt?
You want water?
So, speaking of, let's go really quickly back to breasts.
Okay.
Capsular contracture, how does it feel like? How do you know you have one?
That's a great question. And I just took care of a longtime patient of mine who flew down here to Miami to have her issue addressed. And if you're listening, Dee,
Hi, Dee.
the reality of the situation is that there's some stimulus that causes the body to want to wall off the implant. And it can be, some type of biologic material on the implant, such as bacteria, fungi. It can be seeding of the implant even years later by having nipple piercing and or tattooing in the body can cause and introduce bacteria
Really?
and cause, those areas to see. It's the same issue we have with artificial knee implants.
But if I, like, let's say I get a tattoo on my arm,
It can see
it can,
through the lymphatics all the way to the chest wall. And that can cause, within a few days, weeks, or even months, a tightening, and you'll feel the tightening first before you see any changes. And then we grade these based on the Baker capsular contracture scale, with, in general, a Baker 1 capsular contracture is a level of firmness that's actually not bothersome to most patients, and creates, a kind of a perky, youthful, nubile breast. The opposite extreme is a Baker 4 capsular contracture, where the implant's clearly shifted upwards, and it's tight and hard and painful around the clock.
I have another question.
Ask away.
So for those patients that come out of town to get breast augmentation, breast lift, breast implant, how long do they have to stay in Miami? Because they come with the idea they're flying back 2 days after surgery.
Sometimes,
so,
yeah, you're
yes.
right. But most patients, I think, have got that if you're going to spend the time, the effort, the money,
As Gigi said before.
stay with us for 5 to 7 days
Absolutely.
after one of these operations, because it's a big operation. Even though the incisions might even be relatively small, it's a big operation underneath the skin for sure.
and I think it's because society has made it seem as if plastic surgery is something as simple and nonchalant as going and getting your makeup done at the beauty counter at the
Lunchtime
mall.
facelift.
Like,
Yeah.
exactly,
Yeah.
these types of things. Now, while we have fun in our center, and we do all of our fun TikToks, and we do things like that, it is a serious procedure. You need to be excited about it. You need to feel happy about it, because it is, for me, at least in medicine, it's happy medicine. It's not like you're doing brain surgery. It's not like you're having to take out a kidney. It's happy surgery, because patients are immediately feeling happier about themselves. So it is a more fun part of medicine, but it does come with its same, it does come with risks, and you have to listen to your surgeon. Do not go back the day after surgery. Do not go back 2 days after surgery. You are putting yourself at risk. We don't want to hear from you in New York and saying, oh, but, I'm now developing a fever. Well, you should have been here. You should be seeing your doctor. You should be seeing your massage therapist. You should be seeing the nurse practitioner. We're here for that. And take your medication.
And it's
so
not-
important.
It's not only to get the procedure done by your doctor, and after that you got to do your part. You have to take care of yourself, follow all the instructions.
You're not getting your
It's not
lashes done,
magic.
ladies. This is real surgery, and you're going into general anesthesia.
Yes.
So you have to treat this in your body seriously. And also have fun with it, because you're going through a wonderful, magnificent transformation. So we talked about all of this cerebral things and a lot of conversation about surgery. But I want to know more about you as a person.
Okay.
And which I already know you very well. Ever since you came to work with us, you have been magnificent,
Oh,
and
listen.
you're such a happy person, and you have a wonderful family and wonderful
Aw.
kids and wonderful wife, and he's a very happy man, happy surgeon, happy man, happy husband. He's just always happy.
That's great.
So he goes into surgery. He's never mad. He's just he knows what he's doing. We want to know, what is the secret to your happiness?
So certainly having the love and support of just an absolutely beautiful, hardworking, intelligent woman, keeping everything absolutely in check.
Absolutely.
Yes, and the 3 beautiful boys she's given me, without a doubt. That's the foundation I built off of.
Great. So
Aw.
sweet. Doctor, I want to know you a little bit more, and I know those people that are watching us maybe want to know, where did you grow up? Where did you grow up?
In Saudi Arabia, my parents worked in the oil fields, and they had the schools and the entire system for all of the family support as well.
That's amazing.
And most Arab countries are extremely family oriented. So having all of the stuff for the educational system and all the fun stuff for us to do after that.
How many years were you there for?
15.
So you know Arabic?
Well, yes, ma'am.
Can you tell us something in Arabic?
What do you want to hear?
Everything. Anything and everything.
أنا بحبه.
Anna wahibu.
And what that means?
What does that mean?
I love you.
Oh, you see?
Anna
That-
wahibu.
he's so
Anna
lovely.
wahibu.
Anna wahibu habibi.
Okay, Anna wahibu habibi.
There
Look
you
at
go.
her.
She's already advancing.
And how do you know that
How do
word?
we spell that?
And tell me something dirty.
Okay, so you could say أنت يشتغل خبز خرا, which is gonna be dog crap.
Go eat dog crap. There you go. There's nothing dirtier than go eat dog crap, okay? That very good. Very good. Okay. Look at you. So you know Arabic, you know English, and you do know some Spanish.
Well, I'm learning.
He does learn.
Excellent
he knows a lot.
teachers. Everybody here is an excellent teacher. It's absolutely welcoming and
Okay.
making us part of your lives too.
Absolutely. And I know your
Absolutely.
patients love you, and you have other questions for him, right?
I do. So, doctor, what kind of music are you into?
Anything but rap.
Oh.
Really?
That's not entirely true.
I
but
know. It's not true.
Like rap.
That's not true.
I love all music.
You love all?
I really do.
But your favorite one?
My
have
favorite
to choose
music. Oh gosh, I would probably say like 1980s rock.
like yacht rock.
Yeah,
Favorite singer?
Classic rock?
No, not classic
80s
rock.
rock.
I'm younger than that.
Okay.
One of my friends is a huge classic rock. No, 80s rock. Yeah,
But-
which might be classic rock for you.
What's a band? What's a
But-
band?
Yes.
But like Poison and
Oh, okay, Motley Crue?
and Motley Crue
I
and
went to a
Van
Motley Crue concert.
Halen. So that's the type of stuff.
I had a crush
do.
on Tommy
Awesome.
Lee from
There you
Motley
go.
Crue, the drummer.
Absolutely.
And in a concert, he was like in this round thing, and he was drumming, and it started flipping him upside down. So he was drumming upside down the whole time.
I remember a concert like
You
that
do?
that they played it. Yeah. I
Oh
sure
wow!
I
Did you go to Joshua Tree?
So I have been to Joshua Tree.
Did you
and,
go to the famous U2 concert?
I did, and I also saw them do that in Red Rock, Colorado.
Oh, that's
yes.
amazing.
So that's my favorite band of all time.
U2?
Is U2.
Really?
Yes.
Oh, I love U2.
Favorite band of all time.
That's fantastic. So speaking about music, we'd like to give you a little lesson in some
Are you ready,
in
doctor?
some genres. So we have our wonderful Dunya here, who is a magnificent dancer,
Mhm.
and she wants to teach you salsa.
Oh no.
All right.
Have you never tried salsa?
No.
Oh my God! I
You
will
mean
do my
salsa
best.
with chips? No.
No, we're not talking about that kind of salsa.
Okay.
We're
Just
talking
making
about dancing, move.
Okay.
Okay.
All right. So stand up.
We're
Let's
gonna-
see this.
We're gonna start with some something like this.
You want me to put the
You're
music
too tall.
on for you?
Where's my?
Yes,
where-
please.
do I
Okay.
have heels?
This is gonna be
And-
like wawanko. We're gonna start like
Wawanko.
Dun, 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 dun. Okay?
Okay, hold on.
Okay.
I'm gonna put it
Tan.
on.
Tan. First, when she puts the music, you gotta be ready, doctor. Okay. Listen to the music.
Your feet.
Right? 1, 2, 3. 1, 2,
got it, you
3.
got it.
1, 2, 3. Now you do this to the back, like that. Yeah.
Back to the
This is
front.
a
Back
lot
to
of-
the front.
You can do it. But we gotta do more than one section, okay?
Okay.
You gotta
Feel the music.
Yes.
Gotta
I
feel the
am
music
impressed.
inside.
Yes, I think-
love watching the Latin dancers.
Well,
That
do
they-
you?
Yes, they move so much better
I'm
than
pretty
I
sure that
ever
with
could.
a couple of other lessons, you're gonna get it down
Yes.
perfectly.
And a
And I
bottle of
know,
alcohol would help.
and a bottle of alcohol. Which, speaking of, which is your favorite?
Oh, Jack Daniels, Gentleman Jack Daniels.
Whiskey?
Really,
That's
whiskey.
whiskey, right? My favorite
Tennessee
one. too.
whiskey.
There you go.
All right. And I know that you wanted to teach him something too, and that's why she came dressed the way she
Yeah,
came dressed. She
definitely.
came dressed like this just for you
Oh, God.
and for the dance lesson. So take it
So
over.
I wanted to show you what you can do after you get, your booty, your BBL
Stand
done.
up,
Okay.
doctor.
This is like a really basic twerk move.
Okay.
And I think it's really easy for anybody who's never
Music.
twerked.
Okay.
I want you to put both feet on the ground, plant your heels back, and I want you to shake your knees. Back and forth.
Knees?
Put your knees inside, outside. Inside,
Oh,
outside.
so
And then
this
that
way.
should be shaking back there.
And when does he bend over to the front of the room?
Okay, now you're gonna put your hands on your knees, and you're gonna arch your back up and down.
Does it go that way?
Let's do a little bit to the side so we can see him from the side.
Yeah.
There you go.
I love him. That's what I'm gonna tell him. I love
You
him.
like that? Do you like it?
Yes.
I think you did a good job. You're
I
really
think-
flexible.
But I need your clothes.
I think you have a future here, Doc. I would say a little bit more in the twerking than in the salsa.
Yeah.
I think you're gonna get the
Absolutely.
twerking much
Yeah.
faster.
Yeah.
So stay tuned for our next twerk class with Dr. Dress. I
That's
think
right,
we can even
that's right.
make
I'll
this
teach
into
the
a
next
program.
one.
You'll teach the next
I'll
one.
teach the next
That
one.
sounds fantastic.
In my spandex.
In your spandex. Very, very good. Well, we want to thank you so
Well,
much
thank you
for joining us
having,
today.
This has been a great time.
Thank you.
Thank you so much. And it was wonderful speaking with you, and it was wonderful checking in with all of you here in YouTube. We're going to be doing this very often, so make sure to have fun with us and subscribe to our channel so you are informed with our next YouTube Live. And we want to hear from you. Let us know what you want to see next time. So thank you so much for joining us. Thank you so much, Jesse. Thank you so much, Dunya.
Thank you, guys.
And thank you so much to our guest
Thank you,
of honor,
Gigi.
Dr.
I
Dress.
appreciate it. Thank you all. Have a great afternoon.
Bye.